I'm Sheldon McLeod. This is SaltWire. This is Thinking Out Loud, and thank you very much for spending some time here. And I get to talk about a lot of things with many people, and we just saw the spring sitting of the Legislature wrap up. 14 days of sitting, 6 bills passed, some of the description scant legislative session, according to the story that my colleague Francis Campbell has posted at saltwire.com. And Claudia Chender is also quoted in that story talking about the short session of the legislature. And we are joined by the leader of New Democratic Party of Nova Scotia. This is Claudia Chender. Thank you so much for being a part of the conversation.
Glad to be here, Sheldon.
And quite a solemn anniversary. I think we should probably mention this is happening as Nova Scotians are remembering what happened 3 years ago on this date. And the province has the Premier's asked for a moment's silence. I'm wondering if you have any thoughts on this solemn occasion.
Yeah, well, certainly my colleagues and myself, and I know our entire community, intend to honor that moment of silence. Of course, we have a lot to think about now in terms of making sure this never happens again. And so that's obviously in my professional life where the focus is, really taking to heart a lot of what was uncovered in the Mass Casualty Commission, pushing for a lot of those recommendations to be implemented. But of course, today, the victims are on our minds and in our hearts, and their families and communities. And I think this will forever be a day of remembrance in this province.
And not to connect the last legislative session to that event, but there was a group that made a presentation to the Mass Casualty Commission. Among the recommendations was an end to the abusive use of non-disclosure agreements. And that's something that the NDP that you brought forward. Any comment on the fact that government said it's a jurisdictional review, that's why they're not necessarily in a rush to put this legislation forward?
Oh, it's extremely frustrating. I don't actually believe government, to be quite honest, that that's the rationale. I think they've decided for reasons that they're not willing to share, that they don't want to move forward with this legislation. So, we did get an indication early in the mandate that this was something government was prioritizing. And then we had an abrupt about face. And as I know, you've talked about with folks from Avalon and others who can speak to the issue more articulately, probably, and more directly than I can. This is just a practice that should not be in place anymore. There's no excuse. The idea that perpetrators of wrongdoing can buy their silence and can continue with those patterns of behavior is something I think most Nova Scotians would automatically say doesn't make any sense, and they have. So we know that in general, people support this legislation to stop the misuse of non-disclosure agreements. Of course, there is a proper use for them, and that's trade secrets and things of that nature. But we're talking about the misuse, using these to cover up bad behavior. And even lawyers, so the Canadian Bar Association, 94% of lawyers voted in favor of making these changes. And this government has dug in its heels. We don't exactly know why. No doubt they're getting some feedback from powerful people who don't want this to change. But they've changed it federally in the US and in 17 different states, and as close as our neighbor Prince Edward Island. So we will absolutely keep pushing for this. I think particularly in the wake of this anniversary and in the lead up to this anniversary, where, this is a case of wrongdoing that went uncovered for a long time. But also in the wake of the Hockey Canada scandal, we thought that was going to make a big difference. There was terrible behavior that happened here in Halifax that was covered up by the organization with money that was paid for by parents and others for programs. And, I think it's really upsetting, as I think Dr. McFarlane was in the news yesterday talking about, that, this money for Hockey Canada has been reinstated without an assurance that these NDAs won't be used anymore. So it's a big fight. It's a long fight, and it's one that we don't intend to give up on.
And it is something that we'll keep talking about as well. 6 pieces of legislation in the spring sitting. I believe when we spoke about the upcoming session before it started, I'd asked you if the legislative process was relevant. That's either speaking to, the Premier would say, the efficiency of government or something else. You say it's something else. Tell me your thoughts.
Well, it's absolutely something else. I think, it's the legislature is a really uncomfortable place to be for a sitting government. They are subjected to question period. They're subjected to increased media scrutiny. And so from that point of view, sure, it's less efficient. You can't just do what you want without any interference. But, I continually try to remind this premier and our last premier that this is a democracy, and that, Canadians and Nova Scotians elect their representatives to represent them when it comes to passing legislation that impacts their lives. And the reality is that if we are in the legislature for 2 weeks, in an entire session, an entire season, this would be the spring sitting, we have very little opportunity for oversight. And I think that's something that should concern people. Every bill that got passed in this session got passed after most people were asleep, or were maybe putting their kids to bed, or doing the dishes after dinner, certainly not paying attention to what was happening in the legislature. And that is by design. So this government is deciding to do its work in the dark. And you have to ask why. Why not do it in the daylight when people can contribute and have a say? And, I think as much as we sort of like to criticize federal politics, the reality is they have a functional system. They sit for a decent amount of time. They have committees that really look into bills and hear from experts, and the public can understand that and follow it if they wish. We don't have that here in Nova Scotia. We have very little transparency. We have a government that was elected in part as champions of transparency and democracy. And unfortunately, they've done the exact opposite. So it's harder and harder to understand what government is doing and, to ask the right questions that we're elected to ask.
A government that was elected in large part on a promise to fix the healthcare system. Absolutely. And opposition Tim Houston very much was paying attention to that list of Nova Scotians who were waiting for a primary care provider. Mm-hmm. There's been a change to the way that's being reported. Mm-hmm. What's your perspective of the way things have changed there?
Oh, well, I think it's something we really need to pay attention to. So we know that the latest number of people who are not attached to primary care is 142,000 people. That's a huge number of people. So that's more than 10% of Nova Scotians. And those are just the people on the list. So for all of those people, we know that there are more. This government is trying to make the argument, unsuccessfully, in my opinion, that access to care is the important metric. And access to care means you could go to a walk-in, or you could access virtual care. And what we are saying is that when I talk to people, which I do every day, about healthcare, when you say you want to fix healthcare, everybody has a different idea, right? For somebody, it might be getting that knee replacement they've been waiting for 2 years. For someone else, it might be knowing that a paramedic is going to show up when they call 911. But for a lot of people, it's having healthcare you can count on in the form of some kind of family practice or family health team. We used to call that a doctor's office. We know that that's changing, but I think what people want is to be attached to a healthcare provider. So healthcare they can count on. So if my child is sick, maybe they have strep throat, maybe they have whatever, I want to be able to call the doctor or call the office and say, you have my file. Can I see someone that can help with this? I don't care if it's a nurse or a pharmacist or a nurse practitioner or a doctor, but I want to be able to get the healthcare I need. The other really important example is if someone has a major health issue that they need investigated. So if they have a problem with an organ or they suspect cancer or something like that, well, then you need a referral, and then you need to follow that referral, and you need to check on that referral. None of that can happen through access alone. You need attachment. You need to have a place that has your file that can follow you. You can't get a checkup, those kind of things. And we have seen no progress on that, Sheldon. It's gotten worse and worse. So to your original question about the change in the way that they're reporting it, I think that these numbers, the reporting is changing for the government to try to save face and look better, because they want to say, well, but look, all these people have access. And it's true. The pharmacy clinics, if my kid gets sore throat and I don't have a doctor, or I can't get into a doctor, I can go to a pharmacy clinic. And that's a good thing. That's important. Or I can, I guess, get a virtual appointment, although I think people have varying levels of success with that. But that's not a stand-in for having attachment to primary care. So I think government is trying to slightly do a bait and switch a little bit. So to say, oh, look at these numbers, everybody has access. And what we're saying is that's not what people are asking for. What people are asking for is attachment. They want to know that they have a family health team that they can count on and that will follow their health. And they don't have that. And this changing the way they report the numbers doesn't mean they have that. And we know the numbers are still continuing to go in the wrong direction.
We've had an unprecedented event over the last number of years with COVID-19. Mm-hmm. Another one of my colleagues, Andrew Rankin, did a story about a nurse who's been denied the ability to do her job because of vaccination status. Is it clear to Claudia Chender what the government policy is, whether that's changed? Because the public has moved on not everyone, but clearly a lot of people have felt this is over, but yet the policies have not been clearly expressed or explained to folks. I'm curious if you have any thoughts on that.
Well, from the earliest days of the pandemic, Sheldon, our position as a party has been to rely on public health to guide these kinds of policy decisions. Because we are not epidemiologists, we are not doctors. This is still, it's just been 3 years. It's still kind of a novel virus, I think. And so I think we should hear more from public health. I think we should have more of a conversation about what the restrictions are and why they're in place. Absolutely. I think since Tim Houston took office, public health has disappeared from view. And it's not just that they've disappeared from view, but their funding has disappeared again. So prior to the pandemic, we had our public health funding was not even close to what it should be according to the World Health Organization, which is a certain percentage of your budget. It rose, of course, during the pandemic because of all of the things that needed to be put in place. And now it's back to where status quo, where it was before. So I think we're not properly funding public health. More importantly, we're not hearing from public health. And they are the ones to answer these questions. This, I don't think, is a political question. It shouldn't be a political question. It should be a health question. And the people to answer the health questions are our public health experts. So, we rely on that. What we hear is that these are still, essentially put in place under the advice of public health. So, we'd like to hear more, but until we hear otherwise, we're not going to take a political position on a health issue.
The leader of Nova Scotia's New Democratic Party, Claudia Chender, thank you again for your time.
Thank you, Sheldon.